Okay, so now we're going to talk about dehydration, particularly when it pertains to kids. So there's a high risk of dehydration in children, especially because there's a high frequency of GI infections, so gastroenteritis. And because of this, they lose a lot of fluid. They have diarrhea and vomiting, and there's an increased risk of intravascular volume depletion. Um, so what is the management if you have a kid who is dehydrated? The first step in management is to determine severity. That is the first step in management. And there are three differences that you have to keep in mind. You have to divide it into mild, moderate, and severe. So if it's mild, there are usually no symptoms at all. So almost no symptoms. If it's moderate, you're gonna have symptoms like decreased skin turgor. So your skin is not really gonna snap back as well. Dry mucous membranes and a delayed capillary refill time. Um, Mind you, you have to remember the seconds. It's around 2 to 3 seconds, so it takes 2 to 3 seconds for your capillary to refill. And if it's severe, you're going to have all of the symptoms of moderate, plus you're going to have other important signs like a sunken fontanelle, sunken eyes, and finally cracked lips. And you're going to have an even worse capillary refill time of around greater than 3 seconds. So it's going to take more than 3 seconds for that capillary to refill. So once you've divided it based on whether it's mild, moderate, or severe, the management will then differ. If it is mild or moderate, the best step in management is oral rehydration. So orally rehydrate, there's obviously an increased risk of the child actually vomiting, but that is the step in treatment. But if it is severe, you will have to administer an IV bolus of 20 milliliter per kilogram of normal saline. And this is isotonic. You need to remember that. Isotonic crystalloid is another term that they like to use. And that's the best next step or initial treatment for severe dehydration in children.